Childhood Obesity in the South by Maria Adams, Brenda Bryson, Janet Copini, and Layla Zurak. Monitoring health status to identify and solve community health problems. According to the American Obesity Association, about 30% of the U.S. teens are overweight, and slightly more than 15% are obese. Childhood obesity is a serious disease, says the AOA, President Judith Stern. Some obesity-related conditions once seen only in adults are now common in kids. Children that are overweight can suffer from a number of medical conditions, including high blood pressure, sleep apnea, and liver disease. Overweight children are also at risk for developing type 2 diabetes and heart disease. Primary prevention strategies. Better understanding of the importance of early nutrition. Some data indicates that breastfeeding is protective. Mobilization of schools, communities, and agencies that regulate marketing to children. Screening, measure BMI as children get older with intensified of evaluation and follow-up based on the level of the BMI. Diagnose and investigative health problems and health hazards in the community. Nearly 2 out of 3 Americans are overweight or obese, a 50% increase from just a decade ago. Among children, about 1 in 6 is overweight. For some minority groups, those numbers are even higher. For example, in Hispanic children, about 1 in 4 boys and 1 in 5 girls are overweight. More than 400,000 Americans will die this year from causes related to obesity, which is posed to overtake smoking as the leading cause of preventable death in this country. Addressing childhood obesity in the southern states. Legislative bills are being brought before Congress and National Academy of Sciences for Society, which making come together to stop the rise in the rate of childhood obesity in the southern states. Research is being done to address childhood obesity in the southern states. Schools in the southern states are being held to a higher nutritional standard with school lunch compared to the USDA standards. Policies are helping communities with childhood obesity in the southern states by developing supermarkets that sell more nutritional foods, reducing the number of fast food restaurants in the community, and redesigning neighborhoods to create more opportunity for children to be able to exercise. Exiting policies on childhood obesity in the southern states. Policies that exist being an end to childhood obesity in the South are eliminating drinks that are filled with sugar, fruit juices, and sodas. Exercise programs, school lunches, and school breakfast programs have been put in place. Schools are becoming stricter with vending machines. Schools are introducing children to fruit and vegetables. Schools in the Arkansas is required to put the child's BMI in their report card. Policy development in the southern states. Policies that are being developed to end childhood obesity in the South are America on the Move and Partnership to Promote Healthy and Active Living. The CDC is also involved in helping develop these programs. Supermarkets and farmer markets are trying to lower the price of their fruits and vegetables in lower income areas. In the southern states, foods and drinks that are higher in calories will have a higher tax. Identifying stakeholders and potential facilitators. The stakeholders and the potential facilitators that can put an end to childhood obesity in the South are parents, physicians, schools, community members, and the health department. Essential services. Essential services that can put an end to childhood obesity in the South are active transport to school program, enhanced school-based physical education program, Farm to Where You Are program, Food Policy Councils program, Food Policy Urban Design Transportation Policy and Practice program. Active Transportation to School program. Southern states of Washington initiated and is maintaining safe routes to school programs. Funding provided by Washington State Department of Health. Supports children to encourage in active transportation. Washington State Department of Health has complied and offered resources for sites including walking and biking audit tools and state laws examples to assist in implementation of policy and environmental strategies. FIT WIC Women, Infant, and Children Program. The WIC provides nutritional education and services to women, infant, and children. The FIT WIC provides physical activity lesson plans ideal for preschoolers and their families by incorporating all the benefits of WIC. Provides physical education plan, reproducible parent handout for each lesson, a resource section for further learning activities. Works as a short-term intervention program designed to influence lifetime nutrition and health behavior in high-risk populations. Encourages breastfeeding, which can reduce the risk of childhood obesity. Promoting the menu policy and restaurant programs. State program principal target areas, increasing consumption of fruit and vegetables, decreasing consumption of sugar sweetened beverages, reduce the consumption of high energy dense foods, aim to improve the health of customers by offering and promoting healthier food choices. Assurances are active transport to school program, FIT WIC, which is Women, Infant, Children program, promoting a menu policy and restaurant programs. And here are our references. Thank you. Have a nice day.